Hello and welcome everyone. I am back once again and I have the pleasure of welcoming Dr. Richa Tiwari today. Dr. Richa has achieved phenomenally in AIIMS May 2016 postgraduate medical entrance exam. She has scored a rank 13 and not just that, she has also scored a rank 18 in NIMHANS. Congratulations Dr. Richa on your wonderful performance. How are you feeling?
Thank you. I'm glad to be here. I feel really great. I don't know how to describe it in words. Uh, it's an amazing feeling. I finally feel that my hard work and perseverance is paid off. So,
Well, definitely yes. It was all hard work that has, brought you a rank of 13 in AIIMS May 2016 exam and rank 18 in NIMHANS exam as well. Dr. Richa, everybody would like to know and would love to know the secret of your success.
I think the most important thing is to keep on working till you finally get what you want, because that has done wonders for me. And stay positive, and revision is very, very important. So keep revising. That would be it too.
Well, that's very candidly and very nicely put here by Dr. Richa. May I ask you, Dr. Richa, how was DAMS useful in your preparation?
DAMS played a very big part in my success because before DAMS, after my UG, I knew that I was supposed to crack a PG entrance, but I did not have a direction as how I would go about it. So DAMS told me what to see, what to overlook, and basically it streamlined my efforts so I could, get to this point. So definitely DAMS has played a very big and important part.
Well, those are very kind words. Now that you have, touched the point that you were very serious about the preparation for a PG exam, let me ask you here that how did you manage your time?
Uh, Time management is very important. Actually, during I joined DAMS regular, and later on I joined the AIIMS TND batch, and before joining the AIIMS TND batch, I had good ranks in almost all the exams, but I was not satisfied. I basically fared a good rank in CMC Ludhiana. I got rank 20, and in Manipal I had rank 72. This gave me an impetus that I should, target bigger exams like AIIMS and PGI. And so after that, I started working really hard, and as far as time management is concerned, I in the initial 5 6 months I focused on larger subjects, bigger subjects, and later on I my study was majorly objective based. So that's what I did, and even in one day I tried touching one or two subjects rather than just sticking to one and reading one subject the whole day.
That's really valuable inputs that you have shared with us, and I am sure that all the listeners are going to benefit themselves by your experiences and your information that you're sharing with us. Can you just tell us what would you say as the mix of your success?
Um, Joining DAMS was very important. Then I think regular efforts each day, हर दिन एक नया टॉपिक, एक डिफिकल्ट टॉपिक अपने नॉलेज में ऐड करना was very important for my preparation, because you don't realize that it's just small efforts every day which in the end make up a really big important part of your knowledge. And it's very difficult to revise everything at one go. So these small little things that you do every day, in the end they pay off during your exams. So that was very important for me. Moreover, I had a very supportive group of family and friends who backed me every time that I was low. So that was very important for me, because I'm a person who tends to, for that matter, every student tends to have moments of doubt during the PG preparation. So I would really thank my family and my friends.
That's wonderful. That's very nice that you have told and you have mentioned about your family and friends. They do are a big source of inspiration and support for every student who is aspiring for PG. And now that you have told me that you were going very steady with your studies and you had clear what to do and what not to do while you were preparing. May I ask you, what was your method of preparation? Was it more selective or was it more extensive? How were you looking upon, on all the 19 subjects when you were preparing for tough exam like AIIMS?
Uh, Before my All India PG examination, um, for the initial 5-6 months, I was reading every subject very extensively. After, say, August or July, August, I started focusing on topics which I thought I had lesser command on. So and I kept on revising, but I my approach was more objective based and more based on the subjects I was lacking in. So that was my basic strategy.
Well, I would, to gather the inputs here, I would say it was a mix of selective and extensive study.
Definitely, definitely.
Well, let me remind my listeners, my viewers here, we're talking to Dr. Richa Tiwari, rank 13, AIIMS May 2016 postgraduate medical entrance exam, and also rank 18 NIMHANS. Well, carrying forward this discussion, here, Dr. Richa, as we all know, DAMS is quite active on the Facebook media. We have our exclusive club, then we also have DAMS Cloud. Can we have your experience on these?
I was active on the Facebook Club 2015, and definitely it's very, very crucial because all the controversial questions, teachers, they already research them, find the correct answers, and you can always search everything on the Facebook DAMS page. Moreover, the teachers analyze patterns of questions for the upcoming exams and put updates, which are really important. And they most of the updates are the recent advances in different subjects, which are generally asked in the current pattern of examinations. And also, I would like to mention here that. They put up a lot of visuals on the DAMS Club, and this has really helped me in the AIIMS pattern of examination.
Well, talking of the visual, we also conduct, a DVT session every year at Talkatore Stadium, New Delhi. Did you attend that?
Yes, I attended the DVT session.
How did you feel after attending it?
I think it was very, very important. For those 3 days, those 12-hour sessions each day, I think my basic aim in the DVT session was to look at as many slides as I could and try to make a mental impression of everything so that I won't have to look at things again and again, and that saved a lot of time. Moreover, in the DVT sessions, a lot of very important theory points are discussed. So that was very important, especially when I was revising in the last 1 or 2 weeks. I went through the whole of DVT session. So it helped a lot, definitely.
Well, thank you very much for your inputs here. DAMS also conducts a lot of CBTs around the year. Did you take any of the CBTs that we conduct?
Yeah, the CBT is a very good way to orient yourself to the pattern of All India examination. More so because the evaluation is prometric based. So that was one very good thing. It basically tells you where you are in the competitive system, like where you stand in the whole scenario. But unfortunately, personally, I was not very well prepared for the CBT exam. So for me, it was more of like getting a push to study better. So
it was more of motivational push.
Yes.
Well, that's very nice to know, and that's very I would say that's very modest of you to say that, because a person who has secured such a fine rank in a tough exam like AIIMS, if she says it was just a motivational push, I would not agree with that. Anyways, I just may ask you one thing that comes to my mind, that you have joined DAMS, for a longer course, right?
Right.
And I may just ask you that in the entire time that you spent in DAMS, what changes did you feel in yourself? From the day of joining till the day of exam?
See, basically I said that already, ki initially you have no direction, and you tend to study everything, and it's very difficult to revise all 19 subjects from their standard textbooks in a span of 1 year. So majorly I came to know which things I shouldn't read and which things I should focus more on. And moreover, as a person, I think after joining DAMS, I've become much more perseverant in my efforts, and I've gained a lot much of confidence now. So
Well, that's very nice of you, and thank you very much for those kind words. Let me remind my viewers here, I'm talking to Dr. Richa Tiwari, rank 13, AIIMS May 2016 postgraduate medical entrance exam, and also rank 18 in NIMHANS postgraduate medical entrance exam. We have a lot of publications to our credit. I'm referring to the CRS, that is the Comprehensive Review Series, and the Last Look series we have, and also the Harrison's Notebook. Can I have your opinion on our publications?
last looks, basically, I tried covering last look mixed bag, pathology, and PSM during the entire year. And during my revision time, I basically focused on mixed bag, which has all the subjects in a very short and concise form. So that that was very helpful, especially when there is a crunch of time and you need to go through a lot of stuff in a very short span. So and CRS, I didn't refer to it that much. So
Well, let me just share with my listeners and viewers here that the main motive for having a book series like Last Look is to help you, in short
Exactly.
time, so that you can have a look at the important things before you just step in to write the exam. Let me just ask you one more question before I, get into the final questions. We have, quite rigorous evaluation system. With that, I'm referring to the subject-wise test, the grand test, and the revision test that is been given to the students. How useful do you think these evaluation system has been to you?
During the test and discussion series, I attended, I gave all my exams, all the class exams, and in the online tests, I majorly gave only the grand tests. But the because most of the examinations are computer based, it gives you an idea of how you should manage your time during an exam, and how to go about a lengthy paper or a shorter paper. So I think that was very important for me.
So, what I can gather from your inputs is that our evaluation system at DAMS helps you in learning or practicing the time management during the actual exam, as
Yeah.
well as the learning part.
Yeah.
Well, that's great. That's wonderful. You have been so nicely answering my questions. I'm really thankful to you. And what next question that comes to my mind is, there would be a lot of teachers that would have been your favorite, and कुछ ऐसे teachers भी होंगे जिनकी आप favorite student रही होंगी. Can you just share with us any faculties that influenced you most at DAMS?
Yes, definitely Dr. Sumer Sethi. He has always been there on the club, and even when after All India PG examination, I was a little disheartened because I got rank 2367, but I expected it to be much better. But he was always there saying things like, have faith, have inner peace, keep on working. So those inputs were very valuable for me. And his I mean, of course, he's a very good teacher. So I think radiology was one of my favorite subjects, and my strong points. Then the notes given by Dr. Deepti Bal, physiology Dr. Anupama, then Dr. Sanjeev, pathology notes, they were really good. And not to forget Dr. Sachin for psychiatry, which really helped me in NIMHANS. And medicine by Dr. Arvind and Dr. Rajiv Tiwari for surgery. Brilliant notes, very concise, and very high yield.
Well, thank you very much for all those names that you have mentioned here. As you have said that,
sorry, one
yeah, please.
one teacher I would like to mention, Dr. Ruchi Rai. Her notes were really good, really good. So thanks.
Well, that's great. That's great. And let me just ask you, have you made up your mind, to which branch you are going to opt?
That's a very difficult question right now, but I've been trying to decide between pediatrics and OBG. So let's hope for the best.
Absolutely right. And either way, either branch you choose, we know definitely that a good doctor is going to come up in the subsequent future, and the population at large will definitely be benefited by your services. Before I wind up this conversation, Dr. Richa, may I ask you, do you have any advice for your juniors?
To my juniors, I would like to say, join DAMS, take very diligent notes in the class, try to manage your time well, try to cover as many subjects as you can in the initial 6 7 months. And moreover, now that the pattern is very visual based, look at pictures of a lot of things that you study in your course. And one more thing, try to stay out of negative influences. People saying things like AIIMS just has 40 seats, NIMHANS just has 4 seats. All these shouldn't be, something which should stop you. Keep working, and that's it. All the best to everyone.
Thank you very much. With this, I would definitely would be ending this session. However, I really wish that I would have talked to you some more. Thank you very much, Dr. Richa Tiwari. Rank 13, AIIMS May 2016 Postgraduate Medical Entrance Exam, and rank 18, NIMHANS exam for the post-graduation. We wish you all the best, Dr. Richa Tiwari, in whatever endeavors you take in life. God bless you.
Thank you. Thank you so much.